Hi, I'm Valerie, a registered nurse and health educator specializing in wellness. Things are really starting to heat up this summer, and I want to help you stay safe and alive. Every year, thousands of people end up in the hospital or worse from heat related illnesses. And the scary part is that often it happens faster than you think. You might feel just fine 1 minute and be in real danger the next. Most of these illnesses can be prevented, but only if you know how to protect yourself and recognize the warning signs early. In this video, I will be talking about how to prevent heat illness before it starts, the symptoms that you should never ignore, and when and how to take action if you begin to overheat. Knowing these things can keep a mild problem from turning into a medical emergency and could even save your life. Extreme heat puts a lot of stress on your body. Normally, you cool yourself by sweating and sending more blood to the surface of your skin. But when the temperature, humidity, or your activity level is too high for the heat, sweating is not enough. Your core temperature starts to climb, and that is when heat-related illnesses begin. This can happen to anyone, but some people are at much more risk than others. Older adults are especially vulnerable because their bodies don't regulate temperature as well, and they may not feel thirst as strongly, so they drink less. This makes dehydration more likely. Young children are also at risk because their bodies heat up faster and cool down slower. People who are overweight or living with conditions like heart disease, high blood pressure, diabetes, kidney disease, or lung problems are more likely to struggle in extreme heat, and their symptoms can progress much faster. Some medications can also make things worse. Certain heart medications like water pills, beta blockers, and ACE inhibitors can change how your body handles fluid and make it harder to sweat. Medications for mental health, such as antidepressants, antipsychotics, or anxiety medications, can interfere with how your brain regulates temperature. Drugs for Parkinson's disease or for overactive bladder can also reduce sweating, and even something as common as antihistamines can make it harder for your body to cool down. Stimulants, including some ADHD medications, can raise your heart rate and body temperature, and that increases your risk even more. Even healthy, active people can get into trouble if they push too hard in hot conditions, especially when the humidity is high. High humidity keeps sweat from evaporating, which means your body cannot cool itself as effectively. And also at higher elevations, you're also more likely to become dehydrated or sunburn, which puts even more strain on your body. What makes heat illness so dangerous is how quickly it can progress. You can go from feeling a little tired or have just a little cramping to full-on heat exhaustion in less than an hour. And if you don't act quickly, heat stroke can follow, and that is life-threatening. The key to staying safe is recognizing the early warning signs that your body gives you and taking action right away. That starts with knowing exactly what to look for. So let's talk about the symptoms that you should never ignore and what they are telling you about how your body is handling the heat. The first signs of heat illness are often easy to brush off, but they are your body's way of warning you to slow down and cool off. Ignoring them is what allows mild heat stress to turn into a medical emergency. One of the earliest signs is muscle cramping. So, like painful, tight spasms in your calves, your arms, or stomach are often caused by heavy sweating and electrolyte loss. If you notice this, stop what you are doing, get to a cooler spot, and drink water or something with electrolytes. And then don't jump back into strenuous activity right away. Give your body several hours to recover. As your body struggles more, heat exhaustion can set in. You might feel lightheaded, unusually tired, or weak. Headaches, nausea, and dizziness are common, and your skin may feel cool and damp even though you're overheating internally. If you feel any of this, you need to stop immediately. Move to a shaded or air-conditioned area and drink fluids. If you are not feeling better within an hour, it is time to seek medical care. The most dangerous stage is heat stroke, and this is a true emergency. Confusion, trouble speaking clearly, or even fainting are signs that your brain is being affected by the heat. Your body temperature can rise above 104, and your skin can feel hot and dry, or it could be slightly moist if heat stroke is triggered by intense physical activity. If you or anyone around you shows these symptoms, call emergency services right away and start cooling the body with ice packs, cold water, or a fan while waiting for help. Do not dismiss these symptoms as just being a little too hot or out of shape. They are clear signals that your body is overwhelmed. Acting early at the first sign of cramps, dizziness, or unusual fatigue is what keeps heat exhaustion from becoming heat stroke. The best way to protect yourself in extreme heat is to stay ahead of it. Once your body starts overheating, it is much harder to cool down, so prevention is the key. Start by dressing for the heat. Light-colored, loose-fitting, breathable clothing helps your body release heat, while dark or heavy fabrics trap it. A wide-brimmed hat can shield you from direct sunlight, and sunscreen prevents burns. Sunburns make it harder for your body to cool itself properly. Staying hydrated is just as important, and you need to think ahead about this. Do not wait until you feel thirsty to drink water, because by then you may already be dehydrated. If you are sweating a lot, replace lost electrolytes with a sports drink or even salty snacks to help your body maintain fluid balance. Pay attention to timing. Try to stay indoors or in shaded, cool areas during the hottest hours of the day, usually from noon to 4 p.m. If you need to be active, plan for early morning or evening when it is cooler, and take regular breaks to let your body recover, even if you feel fine. Listen to your body. If you start feeling tired, dizzy, or develop mild cramps, stop right away and cool down. Pushing through these early signs is how people end up with heat exhaustion or worse. If you are heading out into heat that is more intense than what you are used to, it is best to go with someone else and not head out alone. Confusion and poor judgment can set in early when you are overheating, making it harder to notice symptoms in yourself. A buddy can help you recognize warning signs before they become serious. I know several people whose heat exhaustion symptoms were recognized by their hiking partners before they noticed what was going on. If you take medications or have health conditions that make you more sensitive to heat, like I mentioned earlier, be extra careful, especially during long heat waves. Talk with your doctor if you are unsure what precautions you should take. And please also extend prevention beyond you. Check on older adults, young children, or anyone who might not notice the early signs early enough. Helping others stay cool can prevent serious illness and save lives. One of the worst mistakes that you can make in extreme heat is trying to push through when your body is giving you clear warning signs to stop. Heat cramps, dizziness, or feeling unusually tired are not things to ignore. Forcing yourself to keep going, especially with strenuous activity, is how mild heat stress turns into heat exhaustion or even heat stroke. Another common problem is choosing the wrong drinks. Alcohol and too much caffeine can dehydrate you and make it harder for your body to regulate temperature. Even sugary drinks are not that good because they can upset your fluid balance and leave you feeling worse. Stick with water or electrolyte-rich fluids, especially if you are sweating heavily. Overdressing or wearing the wrong fabrics is another issue. Heavy, tight, or dark clothing traps heat and makes sweating less effective. Even indoors, if it is hot, lightweight and breathable clothing can help your body stay cooler. And don't underestimate that indoor heat. Fans can help move air around, but if the temperature inside stays high for too long, your body can still overheat. If you are feeling warm for hours at a time, Take breaks in an air-conditioned space if possible. Avoiding these simple mistakes can make all the difference. In extreme heat, small choices can be the difference between staying safe and ending up in serious trouble. It does not have to be complicated, but it does take paying attention to your body and making smart choices. Most heat-related illnesses can be avoided if you stay hydrated, keep cool, and act quickly when you notice the first warning signs. Remember, cramps, dizziness, fatigue, or even just feeling a bit off in the heat are your body's ways of telling you to slow down. Do not ignore these early symptoms, and don't be afraid to stop, rest, and cool off. Taking action early can prevent a mild problem from turning into heat exhaustion, and it can keep heat exhaustion from becoming heat stroke, which can be life-threatening. So as things heat up even more this summer, take care of yourself and the people around you. A few simple steps and listening to what your body is telling you can truly save lives. If you found this video helpful, please give it a like and share it with someone that you think might need to hear this message. And if you want more science-based tips on how to stay healthy and live well, subscribe to my channel so you don't miss my next video. Thank you so much for watching. Stay safe out there. And as always, please take good care of yourself.